So my first question, which was you were talking about anemia, that's when everything got cut off. So can you just tell me what is iron deficiency anemia? So you can go on first with what is iron deficiency and then anemia.
All right. Basically, before I tell about what iron deficiency anemia is, I want to explain what anemia is. Okay,
Okay.
because lack of iron is one cause of it.
Okay.
All right. So anemia is basically that we know that we have blood in our body, and there are different
Mm-hmm.
components of blood, and red blood cells are one component in our blood, which
Fair
actually
enough.
helps to provide nutrition and oxygen to
Mm-hmm.
various parts of the body. When there is lack of when you don't have enough red blood cells, healthy red blood cells in our body, then
Okay.
definitely that is one cause, that is one thing that leads to anemia.
Mm-hmm.
All right. For
Fair
the
enough.
red blood cells to have if they're healthy and
Mm-hmm.
are properly functioning, they need iron. Basically, it's one of the component of red blood cells. So if you don't have proper iron in your body, if your
Mm-hmm.
iron stores are deficient in your body, then
Mm-hmm.
that leads to iron deficiency anemia.
Fair enough. Acha, can you tell me what how can you detect like what are symptoms of iron deficiency? Like how can one know if they even have it?
Sure. Uh, there are some symptoms that are very
Can you speak
common.
a little
There,
loudly? Can you speak a little loudly, please?
am I clear now?
Yeah, you're better. We're better now.
All right. There are some common symptoms. There are some less common symptoms, and there are complications. Right. The
Okay.
common symptoms that the patient presents to us with is like they
Mm,
come to us and tell us that they are feeling weak. They feel
fair enough.
that they're not able to work properly. They're having difficulty in their daily activities. Along with
Mm,
that, they also tell us that they feel that their skin color changes, that they feel pale a lot.
okay.
All right. Also,
Yeah.
sometimes they also mostly this comes in children that they feel short of breath when they're running or doing
Mm,
certain activities. They feel short of breath, and fourthly, I would say that one major symptoms that they present with is they feel palpitations. That they feel that the heart is racing. So these are some common symptoms that the patient presents with. Along with that, there are some less common symptoms, and there are specific symptoms for iron deficiency anemia, which actually
mm,
helps us to tell that might this patient might have it, right?
fair enough. Mm,
There's one symptom that we call it picophagia.
okay.
Basically, it's a symptoms in which mostly it happens in children, and
Mm,
parents comes to us and tells us that my child eats sand or ice. So that's one
that's so
symptom.
weird. Yeah.
Yeah, but
And is it like common or like is something like very rare?
no, it's not rare and not very common, but it's a symptom that
Yeah.
generally children do present
Okay.
with. Along with that, patient also comes to us telling us that their nails feels brittle, their hair feels brittle,
Yeah.
they don't have healthy hair and nail. Along with that,
Mm.
they might have this painful sores at the angle of their mouth. So these are some less common symptoms, but there are specific symptoms for iron deficiency.
Okay, but so you mentioned like a lot of parents come with children, so I believe it develops at a very early age, right?
It can,
There.
yes, it is, yes,
And
it can. In
is it
children,
most
it's
common
not.
in the early age, or like it's much common in the in people who are teenagers or like elders? Like
It's iron deficiency is one common disease that's you can find it in children, in
okay,
females, mostly these two categories.
okay. So what are the like short term and long term effects that one can have while having this disease?
All right. So short term, it's treatable, so they don't have much long term effects.
Okay.
It can have it's not something you can't have, but let's just talk about the long term first because
Mhm.
as I told you that it's related to your blood. So
Yeah, yeah.
major organ
Mhm.
that is affected because of it is your heart, because the heart is pumping blood
Yeah, yeah, fair
towards.
enough.
Okay, so if you don't have enough red blood cells, enough iron to produce
Mhm.
enough red blood cells in your body, then definitely your heart has to function more than its capacity.
Okay.
All right,
So,
and which can eventually lead to heart failure as well. But that's a
okay.
very, very, very rare complications, and it develops very in later stages. Along with that, there are some other complications as well. That is, females sometimes present with it. That is a restless leg syndrome. They
Okay.
comes to us and tells us that they're feeling certain cramps or certain sensation in their legs at
Hmm.
night, which is one complication basically of iron
Okay.
deficiency.
Fair enough. But like you mentioned with the heart, so it is like it can develop into heart disease, right? So there's high
Definitely, it
chance
can
of it.
actually, yeah,
Patient
there
that.
are chances that it can lead to heart failure actually.
Okay. Is it like generally common amongst more females or like males, or is it like the ratio is there? Okay.
No, it's more common in females
Okay.
because, as you know, that we go through a monthly cycle,
Yeah,
we
yeah.
menstruate, and there are like there are certain days when we are bleeding. So
Mm-hmm.
definitely, the blood loss is more
Fair
compared
enough.
to what men goes through. So there,
Fair
it's
enough.
more common in women.
Okay. So, like, how can you like? What steps are you taking? What should we take if someone has uh, this deficiency?
Basically, iron deficiency is there are certain causes of it. One of the major causes, you don't have enough nutrition, like
Yeah.
iron in your nutrition. Other than that, there are other causes as well, like if you have any disease running in your body already,
Mm-hmm.
then there are chances that because of that you can develop iron deficiency as well, right?
Fair.
But the major cause in Pakistan is lack of iron in our diet. We
Fair.
do take iron in our diet, but there are certain practices because of which we are not able to absorb it essentially in our body.
Fair enough. I understand. But like, how can you like if someone has the issue? Like, what should they eat? What should they avoid? So, can you just
Um,
be briefing of that as
mm,
well?
all right. Eating, basically, first and foremost is the meat. The meat
Hmm.
is the best source of having
Yeah,
iron.
fair enough.
Red
I
meat,
won't.
yeah, red meat. Along with that, organ meat is also recommended to eat to have a good source of iron from it. That is liver and kidney. You can eat it. Along with that, there are some. Apart from that, there are some vegetables like green leafy vegetables like broccoli, spinach that are also rich in iron. Yeah, there are certain grains that are rich in iron. So it's not specifically related to like you can have only
Well, a
iron
lot
from
of food which we generally have iron, right? All the clean stuff. So,
mostly yes, but it's recommended that it's highly recommended that you should take it through meat sources because they can absorb, because your body have ability to absorb more iron from meat sources compared to the other sources.
so. Fair enough. Okay. And what should you not eat, especially, and what stuff you have to avoid if you have that deficiency?
Okay, there are certain food you should avoid taking with iron. Basically, it's not that you should avoid at all. Okay, because we have a practice of drinking a lot of tea and
Yeah,
coffee,
yeah.
milk
Hmm.
in Pakistan. So basically, these three products majorly uh, decrease the absorption of iron from our body. So it's
Okay.
recommended that when you are taking iron, it's better not to take these products 2 hours or 2 hours before or 2 hours after you're taking the iron
But like,
products.
what is the reason behind it? Okay, why? Okay, why? Because can
It's basically
too many.
hinders your absorption of iron from the body.
Okay. So
All
can
right.
it lead to any complication, or like is it just necessary precaution which people generally take?
No, it's the complication itself is that you might not be able to absorb iron and can lead to iron deficiency.
Fair enough. So like, do people can they take supplements to deal with this deficiency?
Uh, if you're talking about treatment, definitely
Yeah.
they need to take the supplements. Along with that, to prevent it, also we do recommend patients to take
Okay.
supplements. But
Okay.
the doses are definitely different for both of them.
Mhm.
If the patient is coming for a treatment, the doses will be higher compared to what we'll be prescribing them when they'll be taking it on regular basis. Along with that, there are certain multivitamins which are also recommended these days that you can take it even if you don't have iron deficiency, because
Okay.
we are not able to take it properly in our diet. So it's recommended that you can take certain
Okay.
multivitamins for that as well.
So, but like,
Also,
it's not
sorry.
that if someone has had that much deficiency, then only they're prescribed supplements, or just anyone can have it on a regular basis, but who have that issue, right?
Yeah, but it needs to be checked by a physician because iron can be toxic to your body as well. So if you are taking it for a very long time,
Mm.
and if you don't have like if your iron is not depleted in your body and you have good stores, then there's no need to take it.
Fair enough. So, like, what if if someone takes it and he doesn't have deficiency? Like, can it lead to any complications? Of what?
There are, yes, there are levels that can become
Okay.
toxic in your body, and that can
Okay.
damage your liver, because liver is
Oh,
where your iron
yeah,
is
yeah.
stored. So
I understood.
there
Fair enough.
is chances that it can damage it. Along with that, I
Right.
just want to highlight that there are people out there who's taking iron without prescriptions, but it is very highly recommended that it should be taken with vitamin C, because vitamin C helps its absorption. So people just take it, and they're not getting the benefit of it. So it's highly recommended that whenever you're taking it, either take it with vitamin C, like orange juice, or vitamin C supplements.
Might be. Do you need a prescription to buy the supplements, or anyone can buy generally? Okay.
In Pakistan, I would say anyone can buy.
No, no, but however, where you're located in, okay, do you need like a
Um,
prescription
Here,
to buy the
uh, as a supplement, yes, you can buy it.
supplement?
Uh, yeah, but there's a certain amount that they can give you. For a treatment level, they need prescription.
Okay, so is there any test which is done to detect if you have this deficiency?
Exactly. It's a very basic test. You guys also do it. It's like a complete blood picture that we order.
Okay,
The one thing that we see is the hemoglobin level in that. That is the
okay,
that helps us to detect if patient might have anemia or not. And there are
okay.
certain other components as well in that that help us to identify
Is
if
there
that
like a
is
certain level of hemoglobin which needs to be present? Like, what's the? Can you like just give us like an exact number? Like, how much needs to be there in your body
happening.
to actually detect
For
this
a
deficiency?
male, the normal levels are around 11 to 14, and for
Okay,
females, I would say, sorry, for males it's 12 to 16, and for females it's around 12 to 14. But anything that is less than 11.4 is actually when we might get
mm.
triggered that this patient can develop iron deficiency anemia.
Definitely.
But that's a very very cutoff level. Anything less than 10, then definitely that needs to look out.
And what's the number where it can lead to hospitalization, or if there's any of that sort? Okay, this level of uh, person level, like hemoglobin level, should be there. If there is there any level where it leads to hospitalization, or is it more of a trigger point? Okay, one should definitely do something about it.
Yes, if a patient is coming with six hemoglobin,
Okay.
HB6, then definitely that's something that needs treatment and that needs hospitalization.
Do you think like, a lot of people have this deficiency and they don't really take care of it? Okay.
Yes, definitely. In Pakistan, it's a very common
Mm-hmm.
thing to have it. There are certain people, like certain category, like certain
Mm-hmm. Yeah.
I would say people out there who will have it and they don't know it. So it's very very highly recommended that just a basic test, complete blood picture, is just a basic test that you can get it done, and you might find out that you have deficiency, and the treatment is also very cheap, not something that
Why do
uh,
you think that people don't take care of this? Like, generally know about this. Like, what do you think is the main reason behind it?
Um, I would say because of lack of awareness, because they don't know that
Yeah.
the symptoms they might be having it is because of that. So
Mm.
one of the reasons I would say is that.
Uh, because what we see here in Pakistan is, especially like in all those villages and like all the downward areas, a lot of people get diarrhea because of lack of the water issue here.
Mhm.
So that's something like me being from healthcare sector as well. I find very few people actually who have this deficiency. Maybe they do, but like you mentioned, a lot of people who don't explore it enough and they don't regularly. Maybe they were having symptoms, but they don't have. There's lack of awareness to actually see what the issue is, right? So
Exactly.
can you recommend a few steps that can be taken that people actually know, okay, uh, like something to be, you said this is not life threatening, but it
Exactly.
may affect you, like you mentioned, okay, the heart, it can affect
In
your
the
heart
long
as well. So
run.
in the long run, if
Exactly.
you don't take care of it, right?
Yeah.
So is there anything else you would like to add regarding iron deficiency anemia?
Basically, one thing we can recommend people is to know about it and to have a good proper diet. And if they have symptoms, because these symptoms are very common, like
Yeah.
anyone coming with generalized weakness, they feel like that it might be because of their daily
Yeah.
activities,
Yeah.
and the symptoms are really common. So even with these common symptoms, you might end up into getting into trouble. So it's better to go see a physician
Yeah.
if you are having mild symptoms as well.
Okay. Uh, Thank you so much, and I really apologize for the earlier delay. There were some challenges going on,
No problem.
and I would recommend all these people who are viewing right now that please take into account with things. There's actually lack of awareness with this disease. Like I feel really bad calling it disease anyway, but still, like it's an issue which people generally should be
Need to
concerned
have.
about. Can lead to long-term deficit, long-term effects. But thanks so much for all the points which you raised, and thank you so much for everyone for tuning in, and take care. Okay,
Take
bye
care.
bye.
Love.